dated 12th. Other than by Wednesdays.
Okay, we are live. Good afternoon. This is Board of Health. All right. Let's see. So this is the first meeting of the year for Board of Health. We actually have 3 new members. Adrienne is not here today. She was unable to come. She just was appointed, I think, less than 2 weeks ago. David? Alyssa? Okay, welcome. I have been chairing the Board of Health. Technically by statute, there should either be 3 commissioners on the board or no commissioners on the board. So we are hoping, and I realize we only have 4, that's okay. It'd be great if we could find a 5th. I would go into a liaison position moving forward, and then the board would chair and have officers set up the same way we normally do. We did not get election of officers put on this agenda, so we can postpone that until the next meeting. That's fine, and I'll go ahead and run the meeting today like normal. Let's see. Are you? We'll just start. Does everybody have the agenda? Got it? Okay. All right. Is there any public comment on items under the board's jurisdiction and not on the agenda? Is there any public comment?
No.
And so you guys know too, Daleen live streams these. They are recorded and they're posted to the county YouTube channel, and people can comment during the meetings.
Nice.
By emailing in. Yeah, it is kind of nice. All right, first thing we have is minutes approval. Did everybody get a chance to look over the minutes?
I'd make a motion to approve the minutes.
And either of you guys can second.
I second that.
Okay, there's been a motion and a second to approve the minutes from December 15th. Tiffany, I'm concurring with you. December 15th, we're talking about the same ones? Okay.
Yes.
Motion and a second to approve the minutes from December 15th. Is there any public comment? Okay. Hearing none, all those in favor, please signify by saying aye. Aye.
Aye.
All those opposed, same sign. Motion passes. Okay. Next on the agenda is discussion decision. Megan Bullock, Broadwater County Sanitarian, request for variance from minimum setback distances listed in ARM, which is, wow, drawing a blank. ARM is administrative, thank you. I'm like additional rules, administrative rules of Montana. Setback distance from septic system to floodplain cannot be met. And you guys should have this in your packets. It'll be the Elkhorn veterinary paperwork. Okay. Go ahead. Hi, Megan.
Hello.
Hello.
So for the new members of the board, I'm Megan Bullock. I contract with the county to do the sanitarian services. So that includes anything with water, wastewater, food, and all other things it feels like sometimes. So what this one is about is the veterinary clinic on the end of town had their septic system fail, and come to find out their property is entirely within the 100-year floodplain. And you should have included with your information, you'll see in the administrative rules of Montana 1736-918 down at the bottom, the rules say that we can have a septic tank in the floodplain as long as the opening is 2 foot above the base flood elevation, but we have to be 100 foot away from the floodplain with a drain field. In this particular situation, the whole property's in the floodplain. There's no way we can get out of the floodplain. So, in the administrative rules under 1736-922, there is a way that they can request a variance from that setback. And so to request a variance, I highlighted that too under item number 2, what they need to present to you to consider that. The floodplain administrator granted them an emergency permit to get it fixed because we were in a situation where we've got wastewater that needs to be dealt with. So he issued an emergency floodplain permit. I did issue a permit. They did fix the system. It was all contingent on getting this variance though. So the problem has been fixed. We are just doing the formality now of getting it officially a variance approved for it.
Okay.
Megan, did you have any concerns?
No, there was some groundwater. I had them do a test pit because I needed to see what the soil was to appropriately size the new system. I had them do a test pit, and there was some groundwater, if I remember, maybe like at 6 feet. But the property drops off. So what we did is we did a type of system. It's called a Presby system. It's rather than having long drain field laterals spaced 7 foot minimum on center, we use this Presby system, which allows us to do a 2 foot separation center to center, and the pipe is a foot diameter, and it winds back and forth in a serial configuration in a bed of a system sand is what they call it. It's like a concrete spec sand. And so we were able to keep our 4 foot separation from groundwater, which is also a rule, but then that sand should also help it with absorption. And we sized it so that it's large. It's larger. They estimated 200 gallons per day. And I didn't think that was probably accurate by the time you have employees and washing down pens inside. So we sized it much larger than that. So I think we did the best we could with the situation we had. Where the system is located is up on a bench before it drops down into the wetter soils there.
So it was a whole new drain field system that was installed, not a repair of the...
No, the system that was there was probably installed in the 70s. There was nothing on file for it. So it probably was not much, and it probably wasn't even constructed to today's standards.
So this is a better option anyway.
I always think if we can do better than what we had, we succeeded. So I think we did that.
Okay.
Yep.
Does anyone else have questions?
Not for me.
Questions? Thoughts?
If there wasn't a way to do it in a way that was safe, would there have been like a containment system they could have done, like a whole tank in ground?
The
What would
other
be your other
options, so
options?
Plan B could have been a holding tank, but economically that's not feasible.
Yeah.
A tank is, even if you went with 1,000-gallon tank, and they're using, by my estimates, 300 to 400 gallons a day, and it's $300 to $500 to pump it. I mean, that just economically doesn't work. The other option could have been for them to hook into the city wastewater system, but then you've got annex. The city would likely want them to annex into the city. So none of them were a quick fix.
I don't know if the city even has stuff out that far.
They have their main line runs right through there. They had to give them an easement to go through there.
Okay. I didn't know that.
So
Good to know.
so it was close, but as far as getting the problem taken care of quickly, that would not have been.
Because their septic failed, right? It started.
It failed, yes. They were literally had outhouses or porta potties. They were not able to use any of the indoor facilities.
Yeah.
That's been in practical use now for how long?
I understood the 70s maybe. It's
Okay, the new system?
oh, the new system,
Yeah.
the Presby system. Gosh, I bet it's probably been 8 or 9 years, maybe, that the state has approved it. Since they
Okay,
approved
so
it.
there's been no problems with what's been in it?
Not that I've seen personally.
The only other question I would have is, do they have the ability the property to expand if they find that for some reason there's insufficiency down the road?
It would be tough because of the depth to groundwater. We aren't allowed to, if we have only 2 foot to groundwater,
Right.
we have to keep a 4 foot of separation. We're not allowed to add material to achieve that separation.
Okay.
So while they have a big parcel there, much of it is down in the marshy area.
Yeah.
Yeah, so it would probably be a very expensive engineered system, the next one. We'll just pray this one lasts for a
That's what I'm-
long time.
that's what
I'm
If the one
thinking.
from the 70s lasted this long, I have high hopes.
Yeah,
Yeah.
absolutely.
Yeah.
Is there any other businesses down in that area that would have a future concern?
As far as having the same type of problem, there's several businesses out in that area. They don't use the water like the vet clinic would though, so maybe, what is the shop out there?
There's like the Kohler Tire, and then there's
Yeah.
like the Top Gun Auto
The Top
Body.
Gun.
Yeah, so both of those would just be, I would anticipate just office space basically. And for people, it's 3 to 5 gallons per flush. So if they each use the toilet twice in their shift, I mean, you're talking very minimal
Yeah.
water.
Okay.
And it wasn't the employee, they have quite a few employees at the vet clinic. I think they said 9 or 10. But that wasn't what concerned me. It was the washing down of the pins and the
Yeah.
kennels and
That's a lot of water.
that generates the wastewater.
Okay, thank you.
Okay.
Megan, if, just looking at this, if we're to make a motion, which we will, I'm sure, variance request, motion to approve the variance request for, is it for you or for the setback for Elkhorn?
It would be
Dictionary.
for the setback listed in 1736-918 of 100 feet from the floodplain. And just so you feel more comfortable, I reached out to Lewis and Clark County and they said they have it happen all the time,
Okay.
where they have to do this, in the Helena Valley especially.
Okay. I'll just take a, is there any other discussion on this? Any other questions?
No.
I will take a stab at this motion, okay? I would move to approve the variance request for setback of 100 feet as listed in ARM 1736-918, Section 1.
Second?
Okay. There's been a motion and a second to approve the variance request for the setback of 100 feet as listed in ARM 1736-918, Section 1. Is there any public comment?
I have an add-on to that.
Yes.
Should we do it to the existing, like that it's already been done, not for all future setbacks? Like if they had another, like it should be just for this one they've had.
The current, it's just for this current
This
variance
current,
request.
yes.
Yeah, it's only for this current request.
Okay.
Okay. All those in favor, please signify by saying aye.
Aye.
Aye. All those opposed, same sign. Motion passes. Megan, you're like the star
Maybe
of
I
the
should
show.
just
Yes. All right, next up, discussion decision, Megan Bullock, Broadwater County Sanitarian, Silos COSA violations letter.
Okay, for the new board members, the reason for this, when a property is subdivided, it goes through DEQ review. And a certificate of subdivision approval, what we call a COSA, is issued. In that COSA, it always specifies what the approval is for, whether it's for one single-family dwelling, one single-family plus some mother-in-law quarters, it specifies in there. Out at the silos, the problem is that many of the people out there have their friends and family and whoever come in with their camper trailers in the summertime, sometimes all year round. But the concern is that if those camper trailers are hooked into the wastewater system that was installed for the house, we're overloading it. It's not approved for that. It's approved for one single-family dwelling. I think through the years, multiple sanitarians have tried to tackle this issue. So this was basically just a letter that will be going out to the people just to give them a heads up that, hey, you have a COSA. Your COSA says you can have one single-family dwelling, just to put them on notice that there are rules that they have to follow. Sometimes people will come back in and they will go back through the process and get a rewrite of their COSA to allow them to have 2 single-family dwellings or whatever they're wanting to do. We didn't find many that have gone through that process, though. So the campers that are self-contained and they come to Rocky Mountain Supply and dump their wastewater tanks or fill their water tanks somewhere, those aren't the concern. It's the ones that are hooked into the facilities that were constructed for the home on the property. And so I think last meeting I was asked to kind of draft my idea of what would be going out. So this is basically just for you guys to look at, shoot some ideas if I need to be a little less harsh or harsher,
I didn't think it was harsh.
more explanatory.
I thought maybe, just because, like you said, there's been a significant history out at the silos with this, and we've had some different different reactions to different people giving notices out there.
Yeah, I will not be popular.
No, it's not popular. However, people need to know why. So I think that would be my one suggestion. I don't think the letter is harsh at all. I think it's you may be subject to legal action. Please call us with questions. I think it's important to maybe state. People may think, okay, well, who cares? It's a single dwelling property. What's the big deal? Great, it's on my COSA, but what's the problem? My friend's using my septic to dump their camper. Why? Who cares?
So maybe a paragraph in there of the importance of.
Yeah, I think just explaining what that means. Like it's stating, it's only approved for one single family dwelling. Like additional usage or usage over that approval amount.
Why the COSA was put in the first place.
Yeah.
Because
And I
it
have
has
had-
failure to the systems, it
Yeah.
can, environmental risks, and maybe
Yes.
having there a side note of examples of violations would be having a RV on site, like as a living residence, or establishing a residence in a shop or something like that, where you have multiple residents on site. Just maybe explaining what the multiple families would mean.
And I have had people inquire, I've visited with them about it, and they say, well, let's just make my drain field bigger. Well, it's not that simple because I have to comply with the COSA, and if it's for one single family, I can't issue a permit that's for a single family plus 3 RVs.
Yeah, I think a little historical context, like a certificate of survey means this. When you're approved for this, you only have this much space, it can fail, here's all the things that can happen. You don't have to get, I don't think,
Okay.
super long, but I think that'll help people understand a little more
Why
they
it's a
don't
big
want to
deal.
take the risk.
Yeah.
Yeah.
And if
Okay.
they would like to continue, they can follow the process to establish.
Like that is an
To
option.
attempt to
Yeah.
establish.
Okay, process.
Yeah.
That's the other kicker is that for me, going through the DEQ process and rewriting is not a big deal. The problem is that planning is the other part of a subdivision. And when a subdivision is done, the conditions of approval might state in there specifically, these are for single-family dwellings.
Yeah.
And then what that requires is they would have to go back through the subdivision, which
That would
would be
it's horrible.
bad.
It's
Yeah,
a
they
horrible
would
process.
probably want to tackle that, but.
I shouldn't say
if they-
horrible, but it's a very long and expensive
That's kind of why
process.
I said, like, attempt, if you want to try this, we can attempt to
Yeah.
follow the process and.
Or at
see
least
what
give them
comes out of
the
it, or-
contact of
Yes.
planning.
Yeah.
Okay.
But I think having some historical context in there, or just more information about Because your average person doesn't know what a COSA is. They don't realize like this is why this is a big deal.
And some people might not even be aware that it's on their property.
It might not.
Exactly.
yeah.
There's so many papers when you buy a house.
Oh, yeah,
You
right.
can't tell me you've read all of them, you know?
Well, and I don't think you necessarily even know what that is when you buy a house. You're
I'm
not
sure,
Yeah, you're not even
yes.
paying attention to it.
Exactly.
So. Education's
So
good.
after reworking this, would you like to look at it again? Should we look at it February meeting, or?
Are you okay with that timeline? Or is it more urgent?
It's an ongoing problem, so
Okay.
yes,
Okay.
it's not,
Yeah, I think it would be good to review. Would you guys like to see it in
Yeah,
February
Okay.
next
Sure.
year? Okay.
yeah.
okay.
That would be-
this is a great start, though.
Yeah, thank you for putting that together.
Sometimes the words are here and sometimes they're not.
All right, you're still in the hot seat. Megan Bullock, Broadwater County Sanitarian, Environmental Health Department update.
Okay, did everybody get a copy of the December activities? I started doing them differently. I'll just do month to month. Before I was trying to do meeting to meeting, and it's difficult going forward to show you guys the difference this December versus the next December, so I kind of switched. Typical for this time of year, issuing of septic permits drops. Not as many systems are being installed. This year, we had such a mild winter, there were still a fair number going in. Food establishments, those inspections will start back up now with the new year. Down at the very bottom, I gave you just kind of some numbers so you can compare year to year. You can see that the number of permits have dropped off a bit. I think, my opinion, it has to do with this water right issue that we're struggling with right now. So for example, in 2024, there were 27 applications that came through for DEQ review. I'm under contract to do those. So there were 27 that came in. In 25, there were only 17. So what that means is no subdivisions are being done. These numbers are family transfers, rewrites, that type of thing on lots that either are not subject to the Platting Act and don't go through subdivision review, or they're a lot that exists and they're just changing something. So not a whole lot of development happening, and I believe it's due to the water rights issue.
I would concur.
Yeah.
Water rights, just the water conversation, more environmental assessments they have to include hydrological studies now for environmental assessments, which really increase the cost. So there's a lot going on, I would agree.
I gave you kind of a summary of how many licensed establishments are in Broadwater County. Tourist homes are not inspected only upon licensing, initial licensing. Those are your VRBOs. After they're licensed, and they're only inspected upon complaints. Motels, trailer courts, mobile food, retail food, those all need to be inspected annually. And so that's what I'll start doing soon. Tattooing and the swimming pool, I defer review on those to the state. I just think there's too much liability there for the county to take on. And other than that, it's just been business as usual.
Can someone license their food truck here, but like never be here? Can they?
They're supposed to license it in the county in which they reside. So there are some of those that the people live here, but they don't vend here. It makes it difficult to do inspections, but the state has it set up that I could inspect an out-of-county mobile, and it goes toward their inspection in the other county. So it's just difficult because mobiles especially have water and wastewater. They need a commissary where they can go every day and clean,
Mhm.
fill up, dump.
Mhm.
And so if they're getting licensed here, it's unlikely they're coming back from Bozeman or Helena every day to
Okay.
fill water and dump wastewater. So it's tough, but they are supposed to license in their residence county.
Okay. Thank you.
Okay,
Thank
no
you for putting
questions?
together that report. Always.
No.
I didn't know we had 8 food trucks.
I know. I was thinking the same thing. Where are these food trucks?
I know.
When does this happen? But they're kind of, like the little snow cone place, stuff like that, that's included in the food trucks, isn't
Yes,
it?
there's a nut guy,
Yeah. Okay, yeah.
there's a coffee one. Yeah, so most of them get licensed. The one out at Silos, they have a second unit that goes to events, travels.
Okay.
Yeah. There was a Mexican one out on Main Street a couple months ago. That one was licensed in Lewis and Clark County, and I'm sorry if you liked it, but I'm probably responsible for it going away.
Oh.
They were approved in Lewis and Clark to come in every day and do their water, their wastewater, and their refrigeration and whatnot. They didn't move as soon as they came here, so I stopped one day and they were packing their water in 5-gallon buckets, and then they had jugs of their wastewater they were taken wherever to dump. And so when I checked with Lewis and Clark, they said, that's not what they're approved for, so they packed up and went back to Lewis and Clark County.
Well, we appreciate you making sure that we're not all getting sick when we eat.
I'm trying,
Seriously,
I'm
that's-
trying.
Yeah, it's hard, and I know there's rules that are probably above and beyond, but that's, it is what it is. So,
Yeah.
Thank you.
Yes.
Ruby is not here. She ended up going home sick, so she will not be giving us an update today. And honestly, her public health emergency plans, which are something she has to do for, it's called FEP, it's her FEP grant, is a key part of what we were going to start working on as a board to help her go through these plans. That's part of our mission, I guess, our, I don't want to say strategic plan, but.
And it's part of our oversight.
Yeah, it is part of the oversight, and then I'm not using the right word that I want, not strategic plan, but, okay. Megan, you said words are hard. Words are hard.
Words are hard today.
It's Monday.
Are we talking
words
about
are
our
hard.
bylaws?
No, not bylaws. Scope. Scope.
There we go.
Yeah, so we have this lovely document. I think you guys should have this in your packets, okay? Scope of the Board of Health. So that is with public health policy development. That's the first thing on there. And that's where we were starting. Ruby was going to talk about that. And
Scope, yeah.
yeah, item number 1 from the scope and how we can help her with that policy development. We don't need to work on that today. You guys can read through this on your own. I will probably send you out more information. I would like to kind of nail down specifically which part of her policy she would like to start working on, and then distribute that to everybody so they can kind
Okay.
of get an idea ahead of time as best as we can. Because that's a hard thing to pull together at a meeting and make happen. So looking at this is under the 2026 planning item. Jumping down to number 3, which is the funding programs. Also something, you guys go ahead and look through. I don't know that we have anything specific that we need funding for at this time. I think that was something we would be kind of figuring out as we worked through the strategic planning and the scope work. But there are some different funding sources and some different things available. Of course, grants are always fluctuating. Was this in your packet?
Who's your
Ella?
grant writer?
Oh, that's funny. We don't have a grant writer. That's great. We would love to have a grant writer. If we could find a grant writer, We have a grant, like Great West Engineering does grants, but those are the very expensive, high-level grants that usually require engineering at some level. The county used to have a grant writer. She was wonderful. She moved away. We would love to find a grant writer because there's a lot of smaller grants that would be good.
Does the, are there specific grant sources that have been identified that, or is this something through the state or?
No, there are different grants out there.
Okay.
And so like this is, and I don't know, I can get you guys this. I thought it was in your packet, but maybe not. They were just kind of,
Yeah,
And
they're
that's there.
right after the
Okay.
scope one.
okay, perfect.
Okay,
So there's some different, this is just information I pulled off online.
yeah.
Rural community programs, we've got this section 330 of the Public Health Service Act, authorizes several federal programs that are available for improving specifically health in rural communities.
Okay.
So there are a lot of different things available. Public health runs, I mean, I would say almost exclusively off of grants. A lot of that is federal grants that are passed through the state and come to public health. So I think I sent you all like kind of an FYI, and I know this was so last month, so I apologize, but like the state is doing better. The Public Health Consortium, they're putting out more information. So I try to pass it on. We all receive way too much email. I realize that. So I can make a note to resend that to you guys. But if you would like to look into it, explore, do some reading, see if there's something that you think would be pertinent to our board and our community, I encourage you to do that. That'd be great. So grant writing, I know in a couple other boards, we have people who are like, we'll just write the grants. You know, we'll just do it as a board, and that's an option. I
Yeah.
will say that any grants that are getting applied for do need to be, like the commissioners need to check off on that and say, okay, just because we want to make sure we have the ability to manage
Mhm.
the grant, the finances, and have everything taken care of. So it is a slow governmental process, but we get it done. So I will send you, I'll make a note to send you that website with information and links. You can do some research. If there's something available, great. They're offering a lot more educational and resource opportunities as well. We could pick this back up for the next meeting on the strategic planning. Let's see. I'm going to make you note. Okay. All right. Let's jump down. I'm sorry. Did anybody have anything they wanted to add to that? Is there anything you're curious about? Any suggestions you might have? Things you'd like to do?
I don't know what I don't know.
All right.
If we were to go after Grant Lindsay, we can bring it here, we can talk about it,
Yeah.
and then whether you're in this position or as a liaison, you'd be able to take that back to the commissioners. for this
Absolutely.
meeting. Okay.
Well, and I think if you knew, like, we always, it's always great if somebody can come in from the board and say, hey, we would like to apply for this grant. Here's how here's the funds we're using for the match, or there's no match, and kind of explain that to the commissioners and give us the information, and we'll go, cool, or no, don't do it. So that's helpful. But yes, absolutely, email me anytime. If you have questions, feel free to call. We are going to, just because this got a little squirrely, we had, like I said, I think we're going to start 2026 over in February. We will worry about the bylaws at that next meeting, and hopefully we can get everybody there. I would say review bylaws for the next meeting. Look at that. They didn't kind of end up on the agenda where it needed to this go around, so no worries. We worked on them last year. We got them done, signed. But yeah, read through them. You can,
Yeah.
reach out with any questions anytime. I will jump really for our last item here. Discussion decision And we always put discussion decision on our items. You need to have that on an agenda if we really want to make an official decision on anything, and you never know. So we put it on there. County website, Board of Health page, updated and new information. I don't know if any of you have had a chance to look at that page. There's nothing there. It's very
There's
plain.
nothing there. I know,
It's
that's what I
just-
said last time.
Yeah, it just lists board members, so we'll update that with the new board members, but there have been ideas in previous meetings this past year of things we'd like to add to that. Tiffany, what do you think? What would you, seasonal updates?
Seasonal updates I think would be great. That'd be like health and illness, that kinds of things. Cold and flu season, we all know those things. When it gets hot, what our community can do. And then I know you can find a lot of this information pieced through the website in different areas, but just because it's in another tab, they might not go to that tab. So maybe like links to the food pantry, or when there's like cheap labs at the hospital, they have like Wellness Wednesdays where people can go get their labs without a provider order for cheap.
Thing coming up to the school, like
Yeah.
the education,
The
like
Baldy
outreaches
education,
kind of things.
things like that.
So here's my thought, because we've kind of gone rounds on that, and there's some things we need to, and I say gone rounds, we've talked about it several times. I am not a website designer.
Thanks to
We
the-
we can access, like we have, the website we currently have, it's much easier for us to get on and do things with our previous one. You could not access anything, like from the back end for staff, it was impossible. So we can look at doing that. I would ask you all to take a look at the site. It's on the Broadwater County website. You'll just go to Board of Health. I will work on getting the names and contact information updated. But please, for the next meeting, have 3 suggestions of what you'd like to see on that website. And then we can talk about how we would like to do that.
I don't even see public health on here.
It's on there. It's on there. It's hard to see. The mobile app isn't as easy.
You want me to bring it up onto the TV?
Oh, yeah, look at that. We have technology, you guys. Here we go.
I have already updated.
Oh,
names.
she did. Okay, thank you. That's good. So we've got that. David, did you see that? She pulled up the website on the TV. David, did you see? She pulled up the website on the on the
okay.
monitor.
Okay, so I heard-
But how did you get there?
So,
I have looked at it.
No, you're fine. You can say how you got there.
let's see, I went to, let me bring this up over here. I can't read it that far away. So I went to www.broadwatercountymt.gov. It brought this page up,
Yep.
and then you go to, let me get my cursor over here, boards and committees.
Mhm.
You go to Board of Health. Now you scroll down, you're at Board of Health. And then here you have, you click here, here's agendas. Here's where you can find the agendas, minutes.
Okay.
There should be, let's see, I guess maybe not on this page, but some of them have forms and documents, but I guess we don't have any of that. Let me go back to the,
It's pretty dry.
here's
Yeah.
the list of all the board members and public health director. When our meetings are, it's fairly just plain.
It's pretty dry. And everything, anything we do, sorry, thank you. Anything we do, I mean, it's all templated, right? Like you have to, like when you go in to edit it, it's not like we can just free for all it, but
Yeah.
we could put more areas, new boxes in there, things with like seasonal, just say seasonal update. I mean, there's a lot of things. So I would just say, for the next meeting, 2 to 3 ideas from everybody on what they'd like to see. And I can do it if it's doable. right?
Uh-huh.
If it's not like super fancy
Mhm.
website magic, I can put stuff in.
Is it like tiles where you can put stuff like?
Kind of. It's when you log in, like, yeah, there's different areas and how you have, but you have to connect everything back to like the back end folders.
Yeah.
So it's not like you're going to do designing, right? It's not
Yeah.
like you're not going to do a lot of creative design. So I would say 3 ideas for the web page, and then because I've mentioned it a few minutes ago, maybe 2 ideas, 2 to 3 each of these things. Ideas for the web page, and then 2 to 3 ideas for the board for either training, resources, grants, things you think the board could be doing.
Okay.
And if you need to, refer to the mission statement and scope, strategic plan,
Mhm.
and that kind of tells you what we're trying to focus on. And we will include election of officers. If you know other people who would be good on the Board of Health, please recruit them. We need 1 additional. It's not a huge lift. Thank God it's not COVID. I think when it was COVID, it was pretty intense.
Mhm.
But we're very fortunate, and we can take some time to do a few different things. And we do health type stuff that you would work on, and health care, then also the environmental health with like the sanitarium and whatnot. So we kind of have that scope. Do you guys have any questions? No? Okay. David, did you have any questions?
No, I think what I need to do is get together with Ruby
Mhm.
and go over the scope and actual programming, find out what it is. I know in the health district I retired from, I know what the scope of our programming was and how each of those programs in terms of hours and budget available, those issues were able to be addressed. And I'm sort of needing that level of orientation so that I understand what it is that the health district actually needs.
Well, and
As a
public
board
health
member.
is actually, they're separate from the Board of Health. But public health, per statute, we help public health with their policy. I don't know that any of us have seen those policy.
Well, not so much
policies
the
for her.
policies, but the actual implementation of programs. For example, AIDS prevention program, bloodborne pathogen program, testing, counseling. What the if there's somebody that actually deals with the epidemiology tracking of TB things. I mean, I'm just throwing things
Yeah,
out
yeah.
that we had done, because that when I understand that, then that lets me know where it is. Maybe I can come up with some
Absolutely.
suggestions.
So Ruby will be at the next meeting. You can ask her. If you want to contact Ruby directly, you are more than welcome to.
Okay, that's what I was going to ask, if that's something that would be intrusive or.
I don't think so. I
Okay.
think she should be able to answer.
No, and her office is just down the road.
Her office is just right behind this brick building across the street. It's directly behind it.
Okay.
Yeah.
All right.
I would give her a call. She's busy. She does time. She helps. I was going to say she does time at the jail. That sounds terrible. She helps with inmate medications and whatnot at the jail.
Right.
So
Yeah.
she's kind of all over the place. But yeah, please give her a call or shoot her an
Okay.
email, and I'm sure she will answer your questions for you.
Lindsay, one thing that might help, are you aware, David, that there's... under
Megan, can you
Montana-
come up here? Sorry.
Oh.
Thank you.
Are you aware under Montana statute that there's local, it tells the powers and duties of the health board?
No, I'm a new resident to Montana.
Okay.
And I know because I dealt with, as the epidemiologist and infectious disease director with our public health department, you know, we were divided in terms of personal health and environmental health. Your job, environmental health. And then in the same department, personal health with the nursing director, where all the issues with immunization, disease tracking, et cetera. And the Board of Health, and I'm talking about the ignorance that I bring here in terms of how this operates. Our Board of Health dealt with the entire structure, and the stakeholders were probably the same, but they were basically the representative from the commission and each of the cities that were within our 2-county area.
So jot
which is a very rural area, by the way.
Jot this down. You can go Google Montana Code Annotated.
Say that again?
Montana Code Annotated.
Okay.
And it would be 50-2-116.
What was that again?
50
50?
-2-116.
Okay.
And that'll tell you anything you want to know about local boards of health.
Okay, yeah,
Okay.
yeah. You know, just getting to understand the structure and function, you know, like I said, I don't know what I don't know.
No, and that's fair. You asking questions is good. I think
Yeah.
it's
So
good to understand
that'll
that.
help at least give you a structure.
Okay.
I think what we realized last year, we attended this, that the Board of Health, you know, public boards of health, education through the state, some different things. And, you know, when COVID was going on, there was tons of activity. And then COVID's not going on, and you're like, well, okay, well, what are we trying to do? Like, what is our role here in the community? So it's really kind of redefining that, because I don't know that was ever really done previously. And if it was, I apologize to the people in the past that I'm stepping on, but I haven't seen anything that says that was done. So that was kind of our goal moving forward, is figuring out, you know, what our scope is, what we could help with in the community, what we could help with, you know, through public health, and narrowing that down. So I do know, like, we officially only need to have meetings, I think, quarterly. I hate quarterly meetings. I don't think you get a whole lot done. Then it's every other month, but people have things come up. So initially, to get started this year, I would like to see us have meetings on a monthly basis. And if somebody can't make it and everybody else is here, that's fine. That's okay, but at least we're kind of moving forward, getting established. And once we kind of get things to where we want them, we can go back to every other or lower frequency. But yes, please reach out to Ruby. Her information is also on the county website, just under Public Health Department.
Great.
Okay.
Yeah.
All right. Is there anything else? Do we have any other comments? Any suggestions for discussion next go round? Okay. And I'll go ahead and adjourn the meeting in a minute, and then we will figure out the next date and time. Okay. All right. If there's nothing else, is there anything from the floor? Anyone? Dog? Hello. That's it? Just a hello? Okay. All right. Thank you. We will adjourn. I don't have my gavel. Sorry.
All right.
It's probably in your drawer.
Probably.